Shawna Rhine, who drove over from the Southern Seven Health Dept. Your travels from Illinois okay today?
Yeah, Route 3 and 146 coming over from Anna, just fine.
Okay, that's good to know. That seems to be what we've been hearing, that the Illinois roads haven't been so bad today. So we're glad you could safely make it over here. And we're going to talk about some things going on. And I understand COVID numbers popping up again? What's up with that?
Actually, COVID numbers did kind of pop up a little bit before the holidays. That tends to happen, and right after the holidays.
Gatherings. Yeah.
Fortunately, what we're seeing, those numbers are going down.
Okay.
In the state of Illinois. Yeah, in the state of Illinois this past week, we don't have any of our counties in high transmission level right now, which is good for our hospitals and our healthcare providers. So we're starting to see those numbers come down.
Oh, that is really good to hear. What about the flu, though? Because it seems like right before the holidays, everyone, or at least someone that you knew, had the flu and they were plagued with that.
Right. I think the last time we talked was right before Christmas, and we did start to see those numbers creep up. We were seeing numbers higher for flu than we had even pre-COVID. Those numbers have come down, and we are excited about that as well. The state of Illinois over the last couple of months has really gone above and beyond in reaching out into our communities, encouraging people to get their flu shot, and making sure they're up to date on their COVID booster. And it's working. Folks are doing very good at following the recommendations that they have in place for the state, and it's making an impact on our hospitals, and that's good.
So do you think we're starting to see that immunity then, or people that are getting the vaccinations, people who have had COVID and the flu too, if we're starting to see more of an immunity, maybe that's why we're seeing fewer cases?
It's hard to say exactly why we're seeing those numbers. What we do know is people are getting updated on their boosters, and we are encouraging residents, over the age of 65, make sure you get that final booster. As far as what we're seeing exactly, again, it's hard to tell. We do know that right after the holiday season, we saw an increase in COVID cases, and some of our numbers kind of tick up. And so it could be that people were going back to some of those, COVID time measures and making sure they were wearing the masks. And those measures actually do help to keep flu cases down as well. So there's a combination of things going on.
All right, talk about tests. I mean, when we were at the height of the pandemic, we had tests coming in from all over the place. The government was sending us them, and people were buying them at the store. What about those being readily available now that this emergency declaration is going away? What can people expect with that?
Well, in the state of Illinois, IDPH is right now working with Project ACT to make sure that we do have access to tests. If you live in the state of Illinois, I can tell you that you do have access to 5 free COVID tests if you live outside of the city of Chicago area. Okay. And you can request those kits at least once a month until they're depleted. So if you've not requested your kits and you live in one of the lower 7 counties in Illinois, you do qualify to receive those tests. You can go online and request a kit, and they'll come right to your door.
Well, something that just came to mind as we're talking about this, I still have some kits that the government sent me in the mail when that was all going on. How long do those last? I mean, what's the shelf life of those?
Well, if you get your test kit, you'll notice that there is an expiration date on that. Recently, the FDA did lengthen the time on that. Again, it's best to check with your provider and find out what that is. It could be 6 months, it could be a year. So again, look at your test kit. To be safe, give yourself a couple of extra months on top of that. But if you have a question about it, you can contact your healthcare provider, and they should be able to help you.
So I guess don't expect for those to last forever is basically the bottom line there. I'm going to have to throw those away eventually. Any other last bits of advice before we let you go?
Well, we just want to, first off, thank the people of our region, not just in Illinois, but throughout the region, in doing their part. Whatever it is that you're doing, keep doing it. It's keeping those numbers down. And the thing is, when you start seeing those numbers tick up, it means our healthcare system is impacted, which means all of the services that our healthcare providers provide is being affected. So we do want to say thank you to everybody for doing their part.
We can all do that. All right. Thanks, Shawna, for being here. We'll take a break. We'll see you back here in a few.